today's patient is CJ. He is referred to us today for health consult as he's unable to perform his current job and is on medical leave for that. The patient's food nutrition related history is a coffee with bagel and cream cheese or an egg and cheese sandwich for breakfast, and will occasionally drink orange juice. Mid-morning he'll have coffee with 1 piece of fruit or a granola bar. Lunch he'll have a sandwich with about 3 to 5 ounces of meat and cheese, 2 cookies, a fruit, and Gatorade. For dinner he'll have a potato with vegetables and occasionally a salad with French dressing or Italian dressing. He'll drink 2 to 4 beers a night in warm weather, and will snack on 1 to 3 times a week. He'll have nachos, potato chips, or pretzels. He reports having some GI upset with his meals. He'll get bloating, reflux, and constipation. And generally, he has a sedentary lifestyle. He's a supervisory position, so there's not a lot of manual labor involved, and he gets short of breath after walking the dog 1 block, and it's not indicated that the patient does any more exercise than walking that 1 block during the day. So this patient is 58 years old. He's male. His height is 5'10". His weight is 187 pounds, which appears stable at this time. And his BMI is 26.82, which is considered overweight. There's no labs available to review, and currently the patient is suffering from emphysema, which was diagnosed 5 years ago. He also had a cholecystectomy about 5 years ago as well. Just to explain those, the emphysema is when there's destruction or distension of the pulmonary tissue, resulting in permanent kind of cell death and lack of function of pulmonary tissue, which results in that wheezing and shortness of breath that our patient is currently experiencing. And the patient also had a cholecystectomy, which is a removal of the gallbladder. In his case, it was due to the presence of gallstones. He also has high blood pressure and hyperlipidemia, which are both controlled with medications at this time. The hyperlipidemia is controlled with Lipitor, and his blood pressure is controlled with some sort of antihypertensive drug that was not specified. As far as we know, his skin status is intact. He was a smoker for 41 years, which is, of course, a risk factor for emphysema, that as well as chronic exposure to polluted air. But in either case, he was exposing himself to polluted air by smoking for 41 years. He's tried to quit 1 to 2 times, and currently is down to a half a pack a day. Looking at his estimated nutrition needs, based on the fact that he is considered overweight, this patient could benefit from some weight loss for his own health. So I use 20 to 25 calories per kilogram based on the recommendation of Nutrition and Diagnosis Related Care by S. Scott Stum, which calculates out to be 1,700 to 2,100 calories a day, as well as 1.3 grams per kilogram given his pulmonary function, and he is currently having some shortness of breath. We want to make sure he's getting plenty of protein to sustain himself there, as that is going to be taking a lot more energy for him just to breathe. His protein for a daily basis should be 110 grams of protein. His fluid is 30 milliliters per kilogram, which is about 2.5 liters per day, and that is something we could consider restricting as well, just as people with any sort of chronic obstructive pulmonary disease can potentially retain fluid as well. As far as we can tell, the patient does not have any special diet order or diet that he currently follows. He feeds independently, doesn't have any sort of chewing or swallowing difficulties, and his intake appears to be good, or over 75% of his needs. So based on the assessment, the nutrition diagnosis I came up with was physical inactivity related to advancing emphysema and increasing shortness of breath, as evidenced by the patient's reported increase in shortness of breath, fatigue after walking the dog about a block, decreased activity at work, and the patient, as the patient was advanced to a supervisory position. Also, the patient appears to have food and nutrition related knowledge deficit related to his emphysema in the post-cholecystectomy diet, as evidenced by the patient's diet recall being very high in fat items and sodium. The patient reports reflux of bloating and constipation without being able to indicate how to regulate those things, and the patient does not have any previous medical nutritional therapy indicated. So for his nutrition prescription, although he might be having some bloating from the cholecystectomy, and because his body's under pressure, a lot of metabolic stress that could be causing it, we want to just moderate the amount of fat he's taking, about 30 to 40% of his total calories, because that is a great source of energy for a patient with emphysema that isn't going to be causing any sort of extra respiratory stress for him. We want to make sure he's getting 5 to 6 small meals a day so that we don't have any sort of pressure put on the lung tissue by the stomach. By having 3 large meals, the 5 to 6 small meals will stress the patient less. We want him to be eating high calorie, high protein, very dense foods, and slowly increasing his fiber intake to about 25 grams a day, and just at this point a no added salt diet to prevent potential fluid retention. The nutrient delivery is going to be through meals and snacks. The patient will be educated on what foods are high protein and high calorie, again, those nutrient dense foods, how to plan and organize small frequent meals, and making sure his fluids are separate from his meals so that he's getting as much nutrient dense food in as possible without feeling full too early. And just talking to the patient about easy to prepare meals that aren't necessarily those convenience foods that you see in the grocery store, which can be high in salt. And that's something we'd want to kind of limit a little bit with this patient at this point. Nutrition counseling, we want to just talk to the patient about this being a lifestyle change and versus being like a quick fix. For him to continue working as long as he would like to, the patient really needs to change what he's doing in a permanent fashion rather than just changing it until he's feeling better. Also, just talking to the patient about increasing his exercise and improving his lung muscle strength to improve his overall breathing ability. So the goals for the patient are going to be for the patient to identify those high protein, high calorie food choices and increase fiber in his daily intake. So again, those nutrient dense foods. We want the patient to be able to reflect those changes toward the diet recommendations in his daily food choices, decrease his GI upset or increase his GI tolerance, and increase the patient's daily activity with steady weight loss. So the criteria for these goals would be, the patient's able to actually list foods that are high calorie, high protein, moderate to low fat. The patient's able to identify sources of fat and protein in the food recall. And the patient's able to identify fiber-containing foods and high-fiber food choices he could make. We want the food journal to indicate the patient is actively choosing these recommended foods and making a change towards the healthier, recommended diet choice for him. We want to see reduced bloating, reflux, and constipation. We want the patient to increase the duration of his walks daily, and also with that we would want to see that he's requiring less recovery time. And as far as weight loss, we want to see 1 to 2 pounds a week until the patient is within plus or minus 10% of his ideal body weight, and that will just simply help him not have to carry around as much bulk and expend as much energy doing his daily activities.